Today I'm going to demonstrate an EJV cannulation. Firstly, I've got my PPE on, glasses, gloves, boots. So if we need to put an EJV in, the first thing I'd be doing would be explaining the procedure to the patient if they were conscious. If they were unconscious and I did need to put one in, I'd be acting in the best interests of the patient under implied consent. So firstly, I've got all my equipment ready to go. So I've got my alcohol swab, my cannula, my gauze, tegaderm, plug, and I've got 2 posi flushes and my sharps container. So we want to distend the jugular vein. So there's several ways we can do this. We could raise the legs of the patient, we could apply pressure, or I could apply pressure to the liver. If the patient was conscious, we could get them to bear down and try and distend that vein, or they could blow in a syringe, or I could tamponade using the supraclavicular method to distend that vein, which is what I'm going to do in this situation. So once I've decided where I'm going to insert the cannula, I would sanitize the site. So to avoid pneumothorax, I want to go as distal to the thoracic cavity as possible, so quite high up on the neck. Using concentric circles going outwards, I'm going to sterilise that area. While it's drying, I'm just going to prepare my cannula. So I've got a saline solution here. It's 0.9% of sodium chloride in 10 mils, and that is in date, and I'd get my offsider to check it.
0.9%. It's 2021 sodium chloride.
Oh, and can you just check that other one for me as well and read it out to me?
0.9% sodium chloride expires 2021.
Cool, thank you. So I do want to avoid introduction of an air emboli into the system as well. So using posi flush, I'm just going to make sure there's no air in there. Attach that to the back of my cannula. So that will ensure that there's no air bubble goes in. So positioning the patient's neck at a 45 to 60 degree angle, and sharps out. Doing the supraclavicular tamponade and applying torsion, going at a 15 degree angle, sharp scratch. Okay, so I've got flashback there. I'm just going to confirm that by applying negative pressure and aspirating back. Cool. Flattening the needle, advancing 3 mils, and maintaining that tamponade. That's the cannula in, and removing the needle, sharps away. A bit of bleeding there, and applying the plug. Just clean that up. So I'll briefly secure that. Now I do want to ensure that that IV is patent and in the vein. So I'm going to flush. Aspirating once more. Cool, I am in the vein. Pushing 5 mils, there's no resistance there, so I'm confident I'm in the vein. Also looking for any swelling, indicating that there might be fluid into the interstitial space, but I'm happy that there's not there. So I then secure that properly using my tegaderm. Also note the date, time and gauge of the needle. On this occasion I've used a 20 gauge needle, but normally we would use a 14 gauge on the road. So now that that line is secure, we could run some fluids or pharmacological interventions there should we wish. and I'd also be looking for any irritation or allergy indicating that there may be an issue with the IV, but in this case it looks fabulous.